Hello everyone. So this video will talk about sinuses in the body. So I have seen a lot of confusions among students about these sinuses. So that's why I have thought to bring this presentation. So let's see. A sinus. What is a sinus? It's a cavity. You can say a hollow, recess, pocket, whatever the name, but simply it's a cavity. Either be empty or filled with some substance. So it can be filled with air, pus, blood, anything. And they are in our body. So when you learn anatomy, you will come across several sinuses. Paranasal sinuses, pleural sinuses, pericardial sinuses, venous sinuses, renal, pathological, lymphatics, arterial. There are so many sinuses in the body, but most of them are not the same. They have their own characteristics. The common thing is that it's a cavity or rather a dilated structure filled with something, and the locations, their connections, functions, they differ. So now let's move on to each of these sinuses and remove all your doubts. Right, paranasal sinuses. So as the name suggests, paranasal, so that is around the nose, cavities. Cavities around the nasal cavity. Paranasal sinuses. And they are within the bone. Right, so these sinus or this cavity, this space is created inside the bone, inside the skull bone, right? So you have several sinuses, like frontal sinus on the forehead, and you have ethmoidal, sphenoid, and maxillary sinus, right? So all these are surrounding the nasal cavity, and they are filled with air, or rather empty. Air-filled sinuses. So we also call them air sinuses. If you heard the term air sinuses, so that is indirectly referring to these paranasal sinuses. They are within the bone, filled with air, right? And also covered with a mucous membrane. See, again, you can see. So this is the bone, the skull bone. So within the bone, you see some cavities. Frontal here, ethmoidal here, sphenoid here, and if you get a cross section across the cheekbone or the maxillary bone, so you have the maxillary sinus, a cavity. The frontal bone, you have a cavity. The ethmoidal sphenoid bone, you have a cavity. So it's simple. And they are in normal situation, in health, they are filled with air. See, this is again the maxillary sinus, and it is covered with a mucous membrane, and they have an opening into the nasal cavity. And this is inside the maxillary sinus. So this is the mucous membrane that I have mentioned. So it lines the cavity, and but the inside is empty. So this mucous membrane, they can secrete mucus, right? But in health, that the secreted mucus will only moist the surface, but will not get filled. But if it get filled, then it is not healthy. Then it is a disease. We call it sinusitis. And if you go to the histology of this mucous membrane, so it is similar to the epithelia, is similar to the arrangement in the nasal cavity. So in healthy sinuses, see, they are empty, only covered with the mucous membrane. But in sinusitis or in disease, so they are inflamed, the mucous membrane is inflamed and a lot of fluid is produced. And that fluid also can get collected inside these sinuses, which will cause a lot of discomfort, headaches. So then you are in trouble. So usually in normal healthy adults, they are empty cavities. This is a radiograph of the skull. So these blackish areas show empty spaces, right? So this is one. So this is the frontal sinus, and here you have the orbital cavity, orbit, and in the middle you have the nasal cavity. So here is the maxillary sinus within the maxillary bone, but on this side, it's not filled with air. There is something solid than that. So then that means this side maxillary antrum or the maxillary sinus is having some pathological issue like sinusitis. So it is filled with fluid, or maybe fluid, maybe some tumor, we don't know. So it's filled with something. And this is again a CT image. See, now here it is sinusitis and it's more or less fluid filled cavity. So you can see it's like a glass filled with water, right? So you can see the line of the fluid level. So both sides have collected fluid inside. So this person is having bilateral sinusitis condition. Here again, you can see an empty sinus, empty maxillary sinus, but the other side is totally filled. So this filling can be either fluid or some other pathology. Right, so that's about the air sinuses or the paranasal sinuses, which are within the bone and filled with air, covered with a mucous membrane. Now we are going to talk about another type of sinuses. So these are dural sinuses, or rather venous sinuses. So the name suggests dural sinus means you know where the dura is. It's inside the skull bone. So these sinuses are also formed within the dura, and they contain venous blood. So that is why dural venous sinuses. And they don't have anything to do with these paranasal sinuses or the air sinuses. These are two different entities. There are no connection between these two. See, you have the dura here inside the skull bone, right? So if you see the arrangement of these dural layers and other coverings of the brain, so on top you have the skull. And then is the dura mater, and this dura mater is made up of two layers. See, the periosteal layer and the meningeal layer. So there are two layers of this dura mater. So when these two layers are going together, there are certain areas that these two layers are not totally in contact. Rather, they are forming some gaps, spaces. And these gaps are not empty, they are filled with blood, mainly venous blood, right? So those are the areas that we refer to as dural sinuses or dural venous sinuses, right? And beyond that again, deeper to the dura mater, you have the arachnoid mater, then you have the pia mater and the brain substance, also the blood vessels and all, right? But these dural sinuses are within the dura mater. See, this is again the arrangement of these dural venous sinuses. So inside the skull bone, you have dura mater. Within the two layers of this dura mater, in certain areas, not the whole thickness, whole area, but in certain areas, there are these sinuses. So according to their position, we are giving names like superior sagittal sinus because it's in the midline, more top. And then below that, there is another one going in the midline. So we call it as the inferior sagittal sinus. And then there is a straight line. So these were curved lines, but now it's a straight line. We call it as the straight sinus. And then all these things come together at one point. All these sinuses meet at one point. We call that as the confluence of sinuses, right? So likewise, it goes on. So see, now even here you can see the paranasal sinuses as well, or the air sinuses. See, this is the frontal bone and you have these cavities inside. And this is sphenoid bone, you have this cavity here. So they are a separate entity. The one we are talking is in the dura mater, no connection with the bone, right? See, this is again dural venous sinuses, straight sinus, superior sagittal sinus, inferior sagittal, straight sinus. So here is the meeting point, confluence of sinuses. And from there to either side, right and left, we have the transverse sinus because it's more transversely positioned. And then it gets a curve here. So then we call it as the sigmoid sinus. And finally, they are draining into the internal jugular vein because it contains venous blood. They have to drain the blood into a major vein, that is the internal jugular vein, right? And also there are other dural venous sinuses apart from the one I have mentioned earlier. We have the superior petrosal sinus, inferior petrosal sinus, and now we have seen the sphenoid bone, and on either side of the body of the sphenoid there is another venous sinus, that is cavernous sinus. So all these are inside the two layers of dura mater still, right? So this cavernous sinus carries some importance, especially of spread of infections, because it has some connections with the extracranial veins. So this is intracranial, inside the cranial cavity, but still it has some connections, some veins connecting the other veins going outside of the cranial cavity. For example, this facial vein. So through this superior ophthalmic vein, inferior ophthalmic veins, the cavernous sinus can have communications with the facial vein running in the face. So by means of spread of infection, it carries some importance, not some, lot of importance. So this is a coronal section across the cavernous sinus. See here again, you can see this whitish line if you see carefully. So that is dura mater, right? This white line. So that is dura mater, and the purple color represents the blood inside. So this is the cavernous sinus. On either side you have, and top you have the brain. And here you have the hypophysis, or rather the pituitary gland. Right, and the other important thing is there are certain structures that runs through this cavernous sinus. So when you consider about this superior sagittal, inferior sagittal, they didn't have any other structures going inside. But here in the cavernous sinus, it carries some structures like nerves and arteries. See, you have the third cranial nerve, fourth cranial nerve, sixth cranial nerve, branches of the fifth cranial nerve, and also an artery, that is the internal carotid artery. So that also carries a lot of importance. And see, here is the sphenoid bone. This is the sphenoid bone, body of the sphenoid, and you have the sphenoidal sinuses. See, the one we have discussed earlier. But this is something separate that formed between the two layers of dura mater. So I hope that is clear, and the difference between air sinuses and these dural venous sinuses. And in addition, there are so many other sinuses as well. So we were talking about venous sinuses, dural venous, and there is another venous sinus very commonly known, that is the coronary sinus. Where you have the coronary sinus? It's in the heart. If you can remember, there was a huge vein, a dilated vein towards the base of the heart, right, which we call as the coronary sinus. So there, it's not, we can't say it's a cavity, but it is a dilated vessel. So again, some space, a spacious area compared to a normal vein. So if you take a normal vein, it's like, it's two parallel lines if you try to draw it, or even the things that you see on the body. But here it's rather enlarged, have a larger diameter and not a very straight line. So it has an irregular shape, right? So that type of a structure can also carry the name sinus. The best example is this coronary sinus, and there also you have venous blood, but the dural venous sinuses is totally a separate thing. The way it is formed now, you know, and here it is a vessel similar to a vein, but it's not that nice parallel arrangement, but a rather dilated and irregular shaped structure. And also talking about the heart, there are some other sinuses also, which we call pericardial sinus. If you can remember, there are two pericardial sinuses, the transverse pericardial sinus and the oblique pericardial sinus. So the transverse pericardial sinus is here between the major vessels, arteries to one side, veins to the other side, and in between you can see, if you put your finger across transversely, so then there is a space in between, and this space is used in surgeries also to clamp these arteries. So since it is running horizontally or rather transversely, we call it as the transverse pericardial sinus. And there is the other one here between these pulmonary veins. We call it as the oblique sinus. So now in this diagram, the heart has been removed. So you are only looking at the pericardial covering, right? So this is situated behind the heart. If you raise the heart a little bit and try to push your hand in, so you will have to go in an oblique direction, and then your fingers will stop here. It cannot cross this border, right? So then your hand is in the oblique sinus. So this sinus is again a space, right? So you know the arrangement of the pericardium. So inside this serous pericardium, you have a pericardial cavity, right? So that is anyway there. But due to this development, so this heart forms as a tube and then it bends and turns. So with this arrangement, when the two ends come to one side, so then there is some gaps created between. So those gaps are these sinuses. So the sinus here is something more than the pericardial cavity, right? See now, this is how you can access this transverse sinus. So then the aorta and the pulmonary trunk will be anterior to your finger, and the superior vena cava and the other veins will be posterior. So in between, you can easily, without any barrier, you can move your fingers across and feel the transverse pericardial sinus. And if you lift the heart and try to go obliquely inside, then you will reach the oblique pericardial sinus. So that is a separate thing again. And so we were talking about veins, pericardiums, and we can see the use of this sinus term with reference to the arteries as well. So one is the carotid sinus. So you have this common carotid, and then it bifurcates in the neck, right? So at the bifurcation point, this artery is little bit dilated. So this dilated part we call as the carotid sinus. So again, it's a dilation, right? Increase of the diameter, like in the coronary sinus. So it's a dilated vein. So here it's a dilated part of the artery. So then again, we have used the term, the artery's name is carotid, and the dilated part we have used as carotid sinus. And in the aorta also we can see this use of sinus at the origin of the aorta, here near to the heart. So again, that part is bit dilated, where you have this semilunar valves, and where these coronary arteries begin, right? So we call it as the aortic sinus. So even dilated areas, dilations, we can use this term sinus. In addition to that, if you learn the arrangement of lymph nodes, liver, kidney, so then again you will come across a lot of sinuses. So here see you have the medullary sinuses, and here of course we call it sinusoids, the pool of fluid here, and in the kidney we have renal sinuses. So again all these are dilations, some spacious areas within these organs with filled fluid, the blood, or whatever the content they carry according to their function. So it is a dilated areas, spacious areas. So with the meaning of that dilation or spacious, we are using this term sinus in the organs as well. And so that is all the normal anatomy, the arrangement of the body. And there is another use of this term sinus in pathologies. For example, if there is an abscess again is a pus-filled cavity, right? So here in relation to these roots, we can see periapical, some so maybe an abscess. So there is some periapical lesion here. And if you see the patient, in the patient's face extraorally, there is some opening. So with the investigations, you will find that this pus collected around this periapical region has now, so sometimes it can localize to one area and they will be there collected. So then we call it as an abscess. But sometimes this cavity can make their pathway through the bones and soft tissues and other structures that they pass by and can drain to some other place, or rather extraorally or even intraorally. So that path of this pus coming out, we call that as a sinus tract, right? So then it is a path of pus, starting from a collection of pus at something like an abscess, and now it is draining somewhere outside or away from the location of the original lesion. So then we call it as a sinus tract. So in dentistry, you will come across a lot of these sinuses in the patients, or rather in extraorally or even intraorally. Here again, the GP has put into this opening to track the pathway to clarify from where this pus is draining. Okay, so with that we have discussed several sinuses, and I hope that you have got the basic knowledge what is a sinus, and so they are everywhere in the body, but simply it's a cavity or rather dilated area, spacious area, can be filled with anything, or rather air, pus, blood, anything. So but they play their own roles, their function is different, so their presentation arrangement is different. So don't just get confused when you see the term sinus. So not all sinuses are the same. So I hope this video will have somehow try to shed some light on you, clarifying some of your doubts if you had any. So thank you for watching the video, and I will meet you again with another area that you will have to clarify. Thank you.